I imagine a world where young people have a seat at any table involving their health and health education, where their expertise about what they need to make healthy decisions is taken seriously and drives change, where all young people have access to the tools they need to make those choices. Instead of being silenced, we prioritize and uplift their voices as an essential component to closing the health equity gap once and for all. My name is Dr. Angela Glimp. My pronouns are she, her, and I am the proud CEO of Peer Health Exchange. The healthier world we all envision, a world that truly prioritizes the health and well-being of all people, starts with the dreams of our youth.
The reality is 80% of young people aren't receiving any mental health treatment. 64% of young people report experiencing serious loneliness, and 20% admit to thoughts of suicide.
At Peer Health Exchange, we create education opportunities for peers to share the tools and resources they need to make healthy decisions. Our current strategy was created in response to a call to action from young people, a call to action that emerged from their increased feelings of loneliness and isolation throughout the pandemic. The context informing our work has shifted, but the need remains stronger than ever as we face a world where protections that enabled our young people to enact their own choices around health are being abrogated. But these threats aren't stopping our work at Peer Health Exchange. They're fueling it. Our first strategic priority is health equity, promoting equitable access to health information and resources by scaling our reach to 1 million more young people nationwide with a combination of school-based and digital programming. Much of the digital progress we've seen has come through our app, Self-See.
I have had therapy on and off, and it's the best thing that I could have done for my mental health.
Sex is whatever me and someone else like and consent to.
And school programming isn't going anywhere. Our legacy work remains strong and relevant even 20 years after it began in workshops in New Haven public schools. We continue to provide comprehensive health education to around 15,000 young people in schools and community-based organizations annually. Our second priority is youth voice, advancing health equity with young people by amplifying their voices and leadership.
Mental health is not a topic that I feel like really gets brought up a lot in my family and my community.
I signed in to be a youth advisor because of the inclusivity for the youth by the youth.
We are the only organization ensuring that every element of our work is informed by young people through coalition advocacy, youth-centered design, and peer education to drive meaningful change in service of health equity. The way we see it, they don't only have a seat at our table, they're leading the conversation. We will build up our digital efforts by growing Self-See and our various social media channels, expanding the Youth Advisory Board to new communities, and deepening our impact in our existing communities. We will also broaden our community-based partnerships to businesses that focus on education or health. Our school-based programming will extend to multi-year commitments in new communities while continuing to integrate our successful peer-to-peer model.
My favorite part about being a fellow for PHE is the ability to give students the resources to advocate for their own health and to be the best versions of themselves.
20 years ago, Peer Health Exchange had a goal of advancing health equity and improving health outcomes for youth. Today, we have succeeded in providing 500,000 young people in classrooms and our digital platforms with inclusive and affirming educational resources supporting identity, mental, and sexual health. We are doing so by uplifting and listening to the vibrant voices of young people and creating as many seats at our table for them as possible. Join us. Pull up a chair.